Hello everyone, welcome back to my channel. Okay, if today is your first time of coming to this channel, please feel free to join us in this ride. Okay, so today I'm going to be talking about uterine fibroids. So I'm just going to be giving a few points about what you really need to know about uterine fibroids. Okay, now uterine fibroid is a non-cancerous growth in the uterus. Okay, so by non-cancerous I mean that it is not cancer, and that is good news actually, because a lot of women actually have could actually a lot of women actually have fibroid. It's just that many don't even know they have it because they are not having the symptoms. So sometimes they are just incidental findings. Maybe something is wrong, the patient comes with a complaint and then you ask for investigations, or maybe during examination you now find out that, or you just find a fibroid. So in situations like that is incidental. It's not like person was having symptoms. So that's it. And then it can affect all women within the reproductive age group, though it is more common in black women. So that means that as a black woman, you have a higher tendency of developing uterine fibroid. Okay, so I'm just going to list some of the risk factors that have been associated with it. Yes, we can't the actual or the exact cause of uterine fibroid has really not been found. However, some risk factors have been documented, and just like I said before, one, race, which is every women in black women have a higher risk of developing uterine fibroid when compared to women from other races. Okay, another factor is a family history. So that means that a lady or woman whose mother had fibroid has a higher tendency of developing fibroid. Then another is other factors, to lifestyle factors have been associated with it: obesity, consumption of red meats, and consuming food that are low in fruits, vegetables, and all of that. So these are just some of the risk factors. Now I'm going to talk about the types, or now I'm going to just describe it, because okay, in describing it I might have to refer to this description later in the discussion. Okay, because okay, we have, based on the location of the fibroid within the uterus, so we have the submucosal one, which is when it is growing on the outer wall or the inner wall of the uterus actually. So it's more like the mass is going to go into the space, the cavity of the uterus. And we have the intramural, which is going to go within the wall of the uterus itself. And then we have the subserous one, which is going to go on the outer wall of the uterus. So the reason why this is important, okay, so that is very important, irrespective of whichever one it is. They still might present almost the same way, but then okay, some symptoms actually have been associated with uterine fibroid. And so if as a woman you notice these symptoms, I think you should actually see your doctor. So some of the common symptoms include heavy menstrual bleeding. So when a woman, we used to use maybe like 3 pads per day, I mean sanitary towels per day, and then suddenly you just realize that gradually you now have to use as much as 6 7 in a day, then you should actually begin to consider that you might have uterine fibroid. And also prolonged menstrual period. So let's say somebody who's normal period lasts for about 3 to 5 days, and suddenly you are having it for more than a week. That should actually call your attention to it. Another is when you have pelvic pain, like the pain is just not going, especially during your around the period of your menses. That could be that could be a pointer to the fact that you might have uterine fibroid. Okay, so a lot of people, then there are some other symptoms that are associated with the excess bleeding. Maybe then sometimes abdominal swelling, and by abdominal swelling is just that it could be very big. And okay, so it ranges in size. It could be as small as very small, like very small seedlings, to being very large. So I remember we had a case where a woman had a fibroid removed, and it weighed as much as 3 kg. That's like the size of a live baby. So it could actually be that big that it will look like pregnancy. That's what I'm trying to say. It could actually be that big. So other symptoms that are associated with the bleeding, maybe dizziness, anemia, the person just feels very tired, lightheaded, dizzy, and all of that. Especially if you notice this during your menses, I think it is important that you see a doctor for appropriate care. So like I was saying, there's this general belief that or a lot of people believe that fibroid interferes with pregnancy. Yes, this is true, but the correct thing is this: it doesn't prevent, like, it doesn't cause infertility. It doesn't prevent it doesn't have any interaction with the sperm and the egg meeting. The only problem is that if the fibroid could occupy space such that it will affect the implantation of the embryo. So, but it doesn't cause infertility itself. So that's where a lot of people get it wrong. So that's why some people think that, if you have fibroid, you will not be able to have a child. No. So I think it is very important that I correct that that idea or that view. Okay, so now I'll just go over to the complications that may be associated with it. So, and these complications is usually based on the size. So for example, it could like I said before, it could affect or prevent implantation of fetus. And then maybe, for example, in a situation where a person is pregnant and the baby is growing together with the fibroid, it might cause what we call intrauterine growth restrictions, such that the baby will not be able to grow as big as it should grow. Why? Because the fibroid is occupying a lot of space within the uterine cavity. Then also it could also predispose to preterm delivery of the fetus. So other could be, if it is very large, it could have a back pressure effect, and then on the bladder, which then affects the kidneys eventually. So but those ones are not usually very common. So there are various modes of treatment, and that is dependent on whether or not the person has symptoms, and also based on the size. So for the incidental findings where the person is not having any symptoms or anything, most times the conservative treatment is done, whereby we just tell the patient not to worry about it and everything. So, and then also we have the the surgical treatment. Now, for the medical treatment, there are some drugs that can be given to actually shrink the fibroid. Why? Because the two major hormones that actually promotes the growth of fibroid is the estrogen and progesterone, and that is why it is usually found in the child in the reproductive in women within the reproductive age. So in postmenopausal women, even those who have fibroid, after when the person enters the menopausal stage, the because of the reduced hormone, the fibroid will automatically shrink. So okay, so that's that. So there are some drugs that can take care of that. Then also we have the surgical treatment, which is which could be either you remove the tumor or you remove the whole of the uterus, if and that is for women who have completed their families anyway, and for those who probably may not want to have more children, or so it just depends on what you want. So you could either have the myomectomy or the hysterectomy. And then there are some other procedures like the uterine artery embolization, that is you block the blood supply to the uterus, and so definitely the fibroid is going to shrink. So this is all that there really is to about fibroid. So I'm just going to say that if you notice, or you know anyone who might if you notice any of the symptoms I've mentioned at any point as a woman, I think it is important that you see a doctor for proper or for adequate management. And also I just want to add to that lifestyle modification too is very important, just like I talk about in a lot of my videos, that watch your diet, so since obesity has been implicated as a risk factor, I think it will be very good if we can pay attention to our diet. Okay, so this is where I'm going to be stopping today. If you have any questions, clarifications, comments, please feel free to drop them in the comment section, and don't forget to subscribe to my channel and also to click on the like button. So see you in my